Hi, everybody. My name is Dr. Rachele Hartley, and work here at PSU. While you are coming in, take a moment, introduce yourself in the chat and your role in the school. And also remember that we have a Q&A link. So if you have any questions, please put them into the Q&A area, and Jeremy will let me know that you have these questions, and I will answer them during the presentation. So a little bit about me. I was a school counselor at the middle school and high school level for 9 years in rural Maine. And I came to PSU 2 years ago, and I've been a faculty member in the counselor education program here, as well as this year, I am now the coordinator for the school counseling program. Working in Maine, I felt like it was a lot like New Hampshire in a way, especially where I was in rural Maine. It was a lot like the North Country a little bit. I was a sole school counselor in one of the schools I worked at, and I worked in other schools that were more similar to Southern New Hampshire, where bigger school, more school counselors, lots of different things that we are seeing. I also did work through COVID, which if you're working right now, you know that our work as educators really changed in the midst of COVID, but even now after COVID, our students have changed. We're seeing more. And that's really what inspired me to do this talk today, is that, there is so much trauma that really became very prevalent working post-COVID, during COVID. And, there's lots of little things that we can do to support our students. So our agenda today is that we are going to talk briefly about how we see trauma in our students. What does it look like? So this is a little bit of science that I do. I'm not sciencey, so it won't be too much. Don't worry. I'm bringing it down for us who are not the science teachers. And then what I'm going to spend most of the time on is trauma-informed strategies that you can use in your classroom. And, I've attended a lot of trainings where they've talked about theory and trauma, handling trauma in your schools, but I'm not doing that. I am bringing it down to things that you can do in your classroom that are, don't take a lot of time, are not that hard, and are really realistic for you to do in your school. And it's important that we do this work because, our students who are experiencing trauma at home, they need our support throughout the day, not just during what we do as school counselors during our guidance lessons or whatever they are, but we really need to do these things throughout. And then towards the end of the webinar, I'm going to go over briefly how we can support a student who's escalating. And I know that, most of you are educators and not school counselors. So I'm not asking you to replace that school counselor. But as you know, sometimes it could take a few minutes before that school counselor gets in there. Or maybe it's something that with these brief skills that I give you, you're able to handle without the support of, one of the mental health professionals in your school. Oops. So let's talk a little bit about trauma. We hear the word and, we all have these definitions that we have in our head. So I want to go over it briefly. And a lot of the research talks about the 3 E's of trauma. And what they are is, one, there's an event. So there's something that happens and it's traumatic. Then we have the experience that we have as the person. So something that goes beyond our ability to cope. So something traumatic happens. So like a car accident, let's just say. And then we have this experience of heightened experience in our bodies, which then has an effect on us, which alters our baseline activity. Now, some trauma can be good, right? Like when we were giving a test to students, like I know my daughter, she just had the PSATs yesterday. Yay, it's that time of year. And, so she was a little nervous, right? Like right before she's taking those PSATs, she's nervous. But it's a one-time event. And she has the support, she has the support of caring parents, and she has the support of her caring teachers as she's going through that. So she's fine, right? Like that's a good experience for her to have and to realize that she can work through it and cope. So we have these, sometimes, like going back to the car accident example, we go through little traumas, we get support, and we can self-regulate. What we worry about in our students, and we're seeing this more and more, and I know I was really seeing this during COVID, was this complex or toxic trauma. So how that is different is when someone experiences, the 3 E's of trauma, but it's frequent. It's prolonged exposure. It happens numerous times. And another key factor of it is they don't have a lot of support. So that's how a lot of our students are experiencing sometimes of, if depending on their home environment, they might be exposed to repeated trauma without the support of a caring adult to help them to regulate their emotions, make sense of the event, and all of those things. So what happens is they have the repeated activation in their body, that's stress hormones, which can really have an impact on their development. And it's more prevalent in kiddos because, as we know, they're developing. So that's why it has a larger effect on them. So let's talk more about the effect. It can really cause harmful, intense distress in them. They're making sense of the world as they're growing up, especially our really littles, and so, having these prolonged traumatic events over a long period of time can really impact their brain response. And love science, not a scientist myself, but I love science, and they are finding that there really is having complex trauma really can impact the brain. So what they say is there's overdevelopment of the lower part of the brain, the emotional part, and underdevelopment of the thinking part. So there is changes that they can see in MRIs from kiddos who have complex trauma compared to kiddos that do not. So we're able to see this now. Now, let's talk a little bit about what we see in our classroom. And this brain alteration can really lead to unexpected behaviors. So we see that fight, flight, or freeze response. We talk about that, that happens in us when we experience a traumatic event. But for these kiddos, it happens more often and prevalent. So we might see that when we don't really expect to see it. They often might seem on high alert status and be really reactive. You put your hand on their shoulder and they, jump up, so they have an adverse reaction. And they might be hesitant to trust adults. A lot of times these are those kiddos that, it's harder to develop a trusting relationship with. And so what is causing these changes? What creates this complex trauma? What's the difference between it and like going and taking the PSATs over one day? And I'm sure you've all heard of the ACEs, the adverse childhood experiences. And this is more prevalent than we think. And I think it's underreported. So even looking at this statistic that came from the CDC, I'm like, my guess is it might be higher. But what they say is nearly 2/3 of US adults, so 63.9%, have experienced ACEs, experience one or more, which is huge. What are some examples of ACEs? I have them down here. Physical abuse, sexual abuse, emotional neglect, physical neglect. These were a lot of the things when I was working through COVID, we were seeing these increase like exponentially. Person with mental health, depression, and suicidality, we're seeing this, right? Especially after COVID. I mean, I know I'm seeing it in adults, kids alike. We might be seeing that in ourselves and our coworkers as well. But what makes a difference in the kiddos is they are experiencing this as young kids over prolonged periods of time, which is causing that brain difference in the development. And the more ACEs that they experience, the stronger the impact. So the more likely we are to really see those symptoms. So what can the ACEs and having complex trauma increase? A lot of things. Research shows that 10 to 12 times greater risk of IV drug use and attempted suicide, 3 times greater risk of developing heart disease and cancer. We learned that a lot with the ACEs research about how, as adults, the kiddos that had experienced trauma, they were experiencing physical symptoms when they were older and not able to make the connection until that research came out. It's been out for a few decades now. And what you're really seeing, because this is happening, even while they're kiddos, is 32 times more likely to have learning and behavioral problems. So that's what you all see as the educators, is that high prevalence of the impact on them being able to be present into your classroom, as well as obtain the information, the great content that you are sharing with them. So overall, I'm not going to show this video. I would suggest you find it on YouTube and watch it. But what it talks about is, if you're like, I really want to kind of learn more about the impact of trauma on the brain, this video is great. It kind of goes in to talk about the differences in the development of the brain with the reaction brain versus the intellectual brain, and talks about the difference in that development. And ultimately, what I want you to take away from this is children really are a reflection of their environment. And this can be a good or bad thing, and I think about, my kids, many of the kids that I know, really supportive adults, in their life, and they come to school and they have that learning brain. They're ready to learn. They're eager to learn. They're sitting in your classroom and they're like, yes, give me this algebra, or, talk to me about that book or whatever it is your content area is. But also, there are kids that are experiencing those ACEs that have that complex trauma, and they're spending most of their time in that survival brain, that reaction, and they are having more trauma reactions. They're having more, they're having a really harder time being able to sit and focus and being able to receive the wonderful content that we want to deliver to them in our classrooms. So I'm going to go over in the next couple slides some specific details we might see, because it's like, yes, we have hyper alert children. What does that look like? So this is what the research is finding, that those kids with the complex trauma as a result of ACEs and other types of trauma, what is it looking like in our classroom? So for social development, they have poor social boundaries and interpersonal difficulties. So they're really having a hard time navigating those relationships with their peers. They, going back to that trust aspect, they might be having difficulties trusting peers. I hear a lot as a school counselor, they're, having difficulty not knowing what to share and feeling connected with their peers because they might be having a very different experience than a lot of them. The troubles that they experience are different than a lot of their peers who don't have trauma. So they might be experiencing isolation and difficulty attaching. We also might be seeing aggression in our classroom. They have a lot of feelings and reactions happening. Remember that change in the development of the brain? So we might be seeing aggression, and that can show up in a lot of different ways, depending on their age and their gender. And, so we know that we see it in a lot of different ways. They might have difficulty differentiating threatening versus non-threatening situations. So that's what I mean about like that unexpected behavior of, they might be having an emotional reaction to something that you're like, wait, I don't expect that reaction from someone. But remember, their brain is structured differently, and it might be reminding them of something that's happened to them, or it's just the brain different structure that's leading to this reaction. So I used to call this trauma brain, of just having that emotional reaction that came up that didn't seem to match the event that was happening. We also might be seeing withdrawal. And I've seen that, I saw that a ton with kids with trauma, is that they were isolating themselves from their peers, from being in the classroom, so they were more withdrawn than the other kiddos. Blaming, they might be pushing it on to other people, and same with us. We see as adults, sometimes we would treat, but sometimes we push the blame onto others. Kids are doing the same thing when they're experiencing these big emotions. Criticizing other people, so again, pushing it off. Enmeshment with their family. So sometimes we see in trauma families that there's very enmeshed and ingrained and really attached and needing each other for reinforcement and so forth. So not that independence that we see a lot in well-regulated kiddos. Also, displacement of dysfunctional family dynamics onto peers, so pushing it on to other people. This is a lot of times what they know. So they might be pushing it on to other people because of that, but also because they're just pushing off what's too heavy for them to experience themselves. So here are some other signs of cognitive development and emotional regulation. We're going to see this even more in our classroom. These struggle with executive functioning. We see that, we know developmentally there's some ages that have difficulty with executive functioning. I have two middle school kids, and I know that they're just learning those skills and practicing those skills, and they're really having a hard time with that. But with our kiddos with complex trauma, it's not about learning it goes beyond that. Like, they're just having a really hard time grasping the concepts and being able to organize their brain to be able to do the executive functioning. So it's beyond what our normal kids, not normal, but like our non-trauma kids are experiencing for difficulty. And this is why sometimes they might be diagnosed and get an IEP for support. We're going to see those fight, flight, freeze responses, and that might be in reaction to a peer interaction that happens in the classroom or in the hallway. It might be in reaction to something we do as an educator, or really anything. It could be watching the video that we're showing in class. So these unexpected behaviors, but more of an emotional reaction than we see in our non-trauma kiddos. Lower frustration tolerance. Similar reason, increased behavioral problems, depressive symptoms, ongoing emotional regulation difficulties. So really, that goes back to the reaction part of their brain. So they're having a difficulty time regulating. And so, I know a lot of times, even myself as a parent, as a school counselor, it's like, okay, let's take some deep breaths and regulate. And we're going to talk about using those techniques later. But, these can be really helpful in coaching our kiddos in doing this, because they're having reactions and they're, freaking out and overwhelmed with the reaction. And they don't know how to regulate it. So that's a big part of our role as educators, is to help them, because if they're having these high level feelings, they're not able to concentrate. Detriments to working memory, detriments to inhibitions, and limitations to complex decision making. And a lot of these are why we see them with IEPs, because they need that extra support and coaching. So ultimately, there's those symptoms, but I want to acknowledge that our kids look different, right? So, your student with trauma might be someone that has a lot of those symptoms that I outlined. So it might be more obvious and apparent, but I also want to say I've seen many kids with complex trauma on this side. Our straight A student, no obvious symptoms of trauma, but it's more internalizing. And I'm seeing it in the school counseling office, them coming in, but they're putting on that face. So, and that's why, I'm going to talk about in a couple minutes of integrating this into our classroom for all students, because we don't necessarily know who those kiddos are that are experiencing trauma at home. And I also want to acknowledge, before I go into techniques, that, individuals who experience trauma, there's difficulties for them. They're experiencing the behavioral, but then it leads to absences from school because they're feeling anxious and having a hard time. And it's leading to, not being able to get the content that we're delivering. And I want to acknowledge that it has an impact on their peers, right? The other 24 students potentially in your classroom, they're being impacted because you're needing to differentiate for, a kiddo that's out a bunch because of experiencing trauma and the mental health they're experiencing, and trying to help everyone to keep up, which then has an impact on us as an educator, because we're trying to do so much. And I know, working as a school counselor, especially during COVID, my teachers were really burnt out because it was just so much that we were having to navigate. And that is still happening today, because as you all know, the gaps have increased in students' abilities and the content that they have. But, the complex trauma definitely impacts that. So what can we do? This is why we're really here, right? Like, what can we do to help our kiddos to be focused in our classrooms, be focused in school, so they can get the education that they need to get them to reach their goals in the future. So there's lots of protective factors that we can foster, and we're going to talk about a lot of the things that we can do, developing a relationship, being that safe spot for them, and then avoiding re-traumatizing. So there's been a lot of research on this. So I'm going to skim over the research and go into the real, the how it looks in practice. But I really like SAMHSA's 4 Rs. So they talk about realizing the widespread impact of trauma, which we're doing. We're talking about that right now. Plus, you've all seen it working in schools. Then the second one is recognition of trauma signs and symptoms. So we kind of went over that today, but, I'm sure you've heard a lot in your, just Facebook and the news and all your other reading resources. And then the third R is responding by fully integrating knowledge about trauma into policies, procedures, and practices. So that's really what we're going to be talking about. How can we make our practices universal for all students, because we don't know who has complex trauma, just to help so everyone's able to focus in our classroom. And then the last part is the fourth R, which is limiting traumatization, can't talk today, of children by decreasing our trauma triggers. And we're going to talk more about that. So how can we minimize the chance of us activating that trauma brain that I call it, or the reactive brain, of causing them to go into the fight, flight, or freeze, or they're not being able to regulate their emotions, or however it looks for them, because as we know, it looks different for all of our kids. So there's been lots of research. So I want to acknowledge some of these images that are out here that you can look up and use. There's the ARC model. There's lots of research on that where they talk about it. The 6 principles of trauma-informed approach. So I'm going to break that down. And what I thought was really helpful to teach, the teachers that I worked with, the paraprofessionals and so forth, to help them in what to implement in their classroom. So the first one is fostering protective factors throughout the day. And we know we have our school counselor friends who do their guidance curriculum, which is awesome. I know a lot of you are doing SEL or whatever you want to call it, curriculum throughout the day. And that's really important. And throughout the day is the really important part, because we know from those symptoms that I talked about with our students with complex trauma is they might have a little bit more of a harder time of transferring that skill to what they learn in their school counseling class to math class or science class or English or whatever the content area is. So it's really important that we integrate the social, emotional, and resiliency building into our classrooms throughout the day. So really getting to know the school counselor's language that they're using in their curriculum and using that in your classroom. And something that I do, even with my teaching in the college level, and I did this at the high school, middle school level, is like normalizing things like being nervous before a test or before a presentation. And so something that I would do is talk about, how do you work through, being nervous for public speaking, talk about deep breathing, or whatever it is. And that might be part of what you do when you're talking about the assignment and you're reminding them of presenting it, as you go over, I know many of you might get nervous before you present. That's normal. Let's talk about things that you can do, deep breathing or whatever it is, and talking about the whole class to that so that they feel like, yeah, getting nervous is normal, but I can get through this. I can see my peers do it and my teacher's there to support me. We can also integrate ways to regulate emotions into their day. So throughout the day, we've heard a lot about like mindful moments, movement breaks. I know that like my daughter's elementary schools did that a lot of like, getting up and doing some sort of quick active activity especially when they were in elementary. Or I know something that I did at the middle school and high school level is when I was going to start a group, I would start with like a 2-minute body scan, and you can find videos online, so you don't have to do it yourself, but just to put on the projector, the 2-minute body scan, and help the students kind of regulate their emotions and slow down. And at first, my high school students, the first time I showed, like a 2-minute body scan or another like mindful video, they were like, oh my gosh, Miss Hartley, what are you doing? But then they started to ask for it. And because they were like, they're all running down the halls, or not running, they're walking, but they're speedy walking down the halls to get from one class to the other. So having that even 2-minute moment to kind of slow down and regulate, that was really helpful for them to slow down that heartbeat, slow down that emotional brain, so that then they can focus on the lesson at hand. And so, I was finding that 2-minute investment was worth it, because it made it helped people focus more, including myself. Also, support and coaching on negotiating conflicts with peers. And, as teachers, educators, paraprofessionals, we are the front lines in education. You know that. So if we see something, it's really important to say something, to help our students feel supported, but also to help them navigate it. Because if they just had a horrible interaction in the classroom or in the hallway on their way to your class, and there was like a fight, verbal, physical, whatever it is, or just even a not nice conversation, they are not going to be able to focus, especially our complex trauma kids. They're going to be really deep in their head. So even though they might look like they're, receiving the information, they probably aren't, because they're thinking, their mind is racing, they're not able to regulate. So really something we can do as a protective factor is really helping helping them figure out those conflicts, making sure if it's not you helping them, making sure you inform someone who can. I know that was a big part of my role as a school counselor, was helping kids navigate conflicts and working with them on that, so that we could invest that time so they could then focus on the work they needed to do at hand.
Just wanted to interrupt briefly. You're doing a great job. And you might want to take a drink or something, or a pause. We're still waiting on some questions. There's been some really easy ones, but don't forget about that Q&A. I know Rachel would love to answer any questions that you might have. And I just wanted to throw that in there, give you a little bit of a break.
Absolutely. Thank you. Yeah. And please ask questions, because I want to make this as applicable to you as I can. So other protective factors are really developing positive relationships with peers. So peers developing positive relationships with peers. So you can do this in a lot of ways, doing check-ins with your students. I start all my classes with, doing a brief check-in, kind of a fun one. And I'm going to talk about that in my next slide. The other thing we can do is really create a safe, warm, supportive learning environment. So helping them feel like they all belong there. Normalize mistakes. Something my daughter's school did was, when the kids made a mistake, they told them to stand up and take a bow. And I thought that was so cute, like especially when my, little elementary daughter, she came home and she's like, oh my God, oh my gosh, I messed this up. But my teacher got a big smile on her face and told me to stand up and take a bow. And it's, that there was potential for anxiety there, but it was diminished because of, celebrating and normalizing that we all make mistakes, and we actually learn more from mistakes than we do getting correct, as you all know. Also celebrating success and, helping them make a plan for working through challenges, because our kiddos with complex trauma, they might not have the skills to be able to work through challenges. Foster executive functioning skills in our classroom every day. So talk about how to study for that test, how to, organize our science notebook, our English notebook, because they might not have those skills. And I know that, working in the high school, it was like, well, they should have these skills already. Many of them don't. They need to be reminded. They're having a hard time transferring the skills. So reminding them of that, the first day of class. And I talked about this one, but supporting the school counseling curriculum, trying to use their language so we can reinforce it, because that repetitive nature is really helpful. But also integrating the MTSS model. I know all the acronyms in education, right? But MTSS is like really cool. I love MTSS, like really identifying that, what we do for everyone is 80 to 90%, but we already know that there's going to be kids that need more. They need us to support them in a different way. And so knowing that when we are developing a lesson and we're making the plan for our class is, how am I going to scaffold and support everyone? Any questions about protective factors?
Well, there are some questions,
Okay.
and we'll go through them. They just came in.
Okay.
First question is, do you have any tips on helping navigate when a student with trauma is talking about something that they are going through to a peer that might not be appropriate for that peer to talk about? It's a really good question.
That is a really good question. And, it's interesting. And I'm wondering if you relate to it too. It's like that really became more prevalent during COVID. It's like a lot of these conversations were coming up where, students were sharing things that maybe were normal in their life, but then it was really, kind of worrisome for a lot of their peers to hear. And, sometimes depending on the setting, if it's easy if you're alone, right? Like if it's you and the kid and you're talking, you can do that empathetic listening and really empathize with their situation, encourage them to talk to the school counselor, the school social worker to get more support. And maybe you even walk them down and, do that connection for them. It's harder when you're in the classroom, right? And there's 25 kids in there and they're sharing that. And so what I think is really important is, empathizing. So really sharing with them, thank you for sharing this. It sounds like it's a really tough situation for you. I do want to acknowledge that, we are doing, a brief check-in and, I want to make sure that we get to everyone. But how about you and I, we can meet after and talk about that. And then maybe in that after time, that's when you do the connection to the school counselor or school social worker to make sure that they get the support that they need. And what I find is if we do that empathy thing before of like, thank you for sharing this, I appreciate it, but then redirecting, they feel supported, but they understand, it helps them understand time and place.
Excellent. And there is one more question, and then we'll move on. And this is a toughie. I certainly don't know the answer. I feel this as a parent. But what do we do with a student that is not wanting to do anything or doesn't even accept help that is offered? They're shutting down and they don't allow you to help or even explain how to help. They're a rock. They stopped. Yeah.
Those are the hard ones, right? And that really became more prevalent during COVID as well. But it was still happening before. And what, I always think my school counselor had is, what's the underlying cause? And so, that's when I really was doing some collaboration with the teacher of like, what are you seeing in the classroom? I would highly recommend that you share that you're experiencing this with their school counselor, school psychologist, or if they have an IEP with their case manager, so that we can really explore what's going on. Because I always think when someone shuts down, it might be an emotional response, so that complex trauma, or it could be, they with combination of it, it could be that they are having, they're really not understanding the content. And because they have that complex trauma and difficulty regulating their emotions, they just shut down. Because going back to that picture of the brain, where if they have that learning brain, then, we can have that conversation of like, yes, let me help you. I can explain it to you. And they're ready to learn. But that trauma brain, that emotional reaction becomes more prevalent, and that's when they shut down. So it means, it takes more time. It means that we really need to do some of that trauma work first, and really exploring the root cause before we can do, before they're able to really focus on the academics. And I love that we're on the slide actually when we do this, because it goes back to Maslow's hierarchy of needs, right? Like if they're having an emotional reaction, they can't, it's hard to chat about it. They're not able to. They're down here and they're just like trying to like regulate, but they're having a hard time doing it. And they're also those defeating stories that maybe they were given, depending on what their trauma is, they might be repeating those in their head. So feeling that that hopelessness or that lack of worth. And so, I would highly recommend if you're experiencing that, really get a collaborative team involved, your administrator, school counselor, so that, they can, as a team, you can investigate what's going on and how to support. That's a really tough one. Okay. So I'm going to talk a bit about how to start your class. And I kind of alluded to some of these, but this is something that I do. And I know that I've seen teachers do it and it's worked well for them. At first, they were like, oh, I don't know, this is going to take time, out of my, already tight schedule, but it really was a good investment. So starting your class, doing a brief check-in, and I'm going to give you some examples, but, I might be standing in the doorway and check in with the kiddos so that maybe they need a snack, maybe they need water, and you can kind of get that going before you get your class going. Maybe you have some in your classroom, because if you're the first class of the day and they haven't eaten since lunch the day before at school, it might be hard for them to focus. So making sure you encourage those kids, especially that like, hey, make sure you go get breakfast before class or whatever it is. You can also do a warm-up activity, after you do that initial check-in. Maybe it's that mindful moment I talked about. Maybe it's on any other type of check-in. And, I have a fun time with personal weather report. So, and I always try to say for myself, cloudy with a chance of meatballs, just because it's fun. But like I did it in class last night, and it helps you to really get a good idea of where students are. I had students that were like, yeah, I'm pretty cloudy, or I'm cloudy with the sun just starting to come in. So it helps people be creative in describing where they're at, but it also normalizes talking about emotions. And then I'm able to reflect like, yeah, it sounds like, we're a little bit of everywhere today. So let's support each other in really able to focus on the content that we need to get through. It doesn't take long. I think last night, I had like 15 students in my class and it took like 3-4 minutes to do that check-in, but, it helps set the stage. I also ask about like what color represents you today, what animal best represents your mood. That's a really funny one. Students of all ages like that. If you had to eat one food for a week, what would it be? So like asking fun questions. I had a social studies teacher I worked with for years and years, and she did a rosebud and thorn a lot of times, like with her advisory when she had more time. She would do that to just get them going. And then the second part would be, setting a goal for the day, because again, a lot of these students have difficulty with executive functioning. So helping them really focus it down. And I've seen some people that have done like check-in slips or so forth so that they write it down and bring it up to you. And then you can reinforce them in reaching those goals. So let's talk a bit about class structure. So with structuring your class, it's like with parenting, right? We want to be on that authoritative side. Like this is the zone where we want to be. So that means high structure and high support, high expectations, but high support, and so we want to set high expectations and structure for our kids. But the really, really important part, especially for our trauma kids, is that high support part. We're not just leaving them alone to their device to meet these high expectations, because they might not have the skills to be able to successfully do that. We also want to be predictable in our structure. So have a routine, be clear if we're leaving the routine, and the routine can be simple. Like the routine for my class, the structure is like a check-in, content, applying the content, checkout, right? So, but the students know we're kind of going to go along in that structure. And I communicate with them a lot if we're going to change it or whatever it is, so that, the trauma brain can like, okay, I see what's coming. And that really helps. Brain breaks, body calming opportunities. So this looks different at each level, but, I put breaks in my class, here's 5 minutes here, 10 minutes there, just so they can go get a glass of water, go get, a snack, or just stand up and use the restroom or whatever it is. Scaffolding, we identify everyone needs different supports. You all know that. Celebrating success, open communication. They say this a lot with trauma work, is having a no surprise culture. So that goes back to that clear expectations, clear communication of what's going on. Transparency and decision making. So like I'll talk about like, hey, I need to move this deadline. Here's why. Does this work for everybody? So bringing people into the conversation. We can do that some more in some situations than in other situations, especially based on age. That's going to look different with kindergartners than high school students. But, being flexible, normalizing making mistakes. So like I, said before, maybe even celebrating it, and sandwiching our feedback. And what I mean by that is, providing, even when I'm grading and I'm giving feedback on assignments, it's like I identify strength, something they did well. I identify areas of improvement, and then I kind of end with a strength. So like an Oreo cookie, of layers of feedback. And that really goes a long way. Because if we start with the negative, they're going to stay there in their emotional response, and they're not even going to get to the positive. I knew I had more. Hold on. There we go. Okay. So discipline in the classroom. I know we all don't want to be doing that. We want to have the best structure to prevent issues, but we know they're going to happen. Right. So when we talk about discipline in the classroom, I feel like this picture does represent it. It's like we get down with the student on their level and we try to talk to them about it. And I'm going to go in more detail about that. But taking a less punitive approach, but a more supportive approach, more curious approach of figuring out what's going on for them. Because a lot of times with our trauma kiddos, they're not trying to be manipulative or anything like that. They're just having an emotional reaction. So really, asking the question, like, help me understand what you're experiencing, or how can I support you? Instead of saying, things like, what's wrong with you? And I don't think any of us would intentionally say that, but it's easy. Like when we are, we're looking at a kid and it's a huge unexpected behavior. And it's like, whoa, what is happening here? But really getting down to their level, just as this woman is, and, asking, help me understand what's going on for you right now. What are you experiencing and how can I help you? Another thing with discipline in the classroom is consistent consequences. Working as a school counselor, a lot of times our trauma kids were the ones that could tell when they were being treated differently or whatever it was. So, not that we can't personalize our consequences, but making sure they're consistent. The athletes aren't getting away with certain things and so forth, just making sure that it's clear across the board what the natural consequences are for things, and delivering that in a respectful, empathetic way. But that can be easier said than done, especially when we, are in a classroom or trying to navigate a lot, but really working on that to help with that. Also advocating for positive interventions for prevention, like PBIS, more acronyms, restorative practices. We were really big with restorative practices, which really helps to build community, talking about what's happening and building empathy. And these practices are really found in the research to be proactive in supporting to prevent issues from happening, but also to support people in how to act, how to intervene when something does happen. I keep going forward. Sorry about that. And then I want to highlight that a lot of these things, they help us too. Like the mindful moments, I needed that. We're teaching like education. We all know, like we're going bam, 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 bam. And we don't even have time for a restroom break a lot of times, or lunch. Who has lunch? So, having mindful moments at the beginning of all our classes helps us. It helped me, when I'm running to get to the intervention block, when I ran my groups, they were able to have a mindful moment, but so was I, which helped me regulate. Being transparent in our classroom, having that no surprise culture helps us too, so that we can be really clear. And if like we go to a conference or we're sick or whatever it is, and we need to change things, they understand that we've made that culture in our classroom where we can communicate and be flexible based on our needs within reason. Flexibility in how students present their knowledge. So allowing them to do a video or an essay or whatever when we can, we can't do that with all assignments, but that helps us because it makes it more stimulating when we're grading. I know when I'm grading 25 essays on the same topic, I start to like glaze over, right? But when it's varying forms of delivering the content, it's like, okay, this is more fun to get through, instead of glazing over on the essays. Having a more collective approach in teaching and really creating a warm collective environment that helps them have ownership in the content, but also helps us in making it more stimulating, and maybe we get a break and we can hear that different perspectives. And it's also important to like respond to things like current events, like what's happening in Israel right now, which helps us too. I'm not saying we have to dedicate our whole class to that, but acknowledging it, because with our complex trauma kids, as with any kids and adults, it can bring up emotions from past experiences for us. So it's more important to acknowledge them for everyone and give everyone maybe a moment of pause, so that we can regulate, have time to do that, and then get back to the task at hand. So as we know with everything, prevention cannot prevent everything. So there's always going to be that time when that kiddo escalates in our room. I don't know why it's going forward. Sorry about that. And we need to provide them support. We've had our trauma-informed classroom, but a kid still escalates for some reason. It's going to happen. I'm not going to deny that. So what can we do? We can remember the 3 R's, which is to help the student regulate. So remember, with that kid with trauma, the emotional brain is activated. So they're going to have that fight, flight, or freeze response. And I know, for a lot of us, myself included, our instinct is to like talk, and help, to talk about what's happening for them, but they're not able to listen. So the first step is to really be with them and model how to regulate. So a lot of times what I'll do, if like the kid is in the corner on the ground, I will get down with them and I'll start deep breathing to kind of model that. And I will invite them to join me. Or if they're frustrated and angry, maybe I will model with them to go out for a walk, down the hallway. And, as a teacher, you could do this if you had a parent in the room, or maybe getting another adult to come in. But I know it's hard when you're by yourself, so it might look differently. But if you're able to, go for that walk for them. Maybe put on calming music in the whole room and just kind of help them to have that space. So the first step is to help them regulate so that they are able to hear us and our information. So once they calm a little bit, then we go to the second R, which is relate. So this is where we use that empathy, and we connect with them or empathize, so it might be something like if they have a really hard time and they escalate after getting a grade for a test, and they didn't do what they expected. Then, we can relate to them by saying, hey, I can tell that you were really disappointed with your grade and it was very upsetting with you. And I know that, it's very common, myself included, to get upset when we don't meet, get the grade that we're hoping for. So we're connecting with them and saying like, I see you, I hear you're upset, and I validate that. So that quick sentence can be really helpful. Maybe it's more than a sentence. Then once they've regulated, they heard that we care. And that's the big thing, to show that we care. Then we can reason with them and have that conversation. So we can talk with them about what happened and how we could react differently, to prevent this one from happening in the future, or prevent them from really having an adverse reaction that might get them in trouble. But if, we don't do these first 2 R's, they're not going to hear us in the conversation. And I think so often we're in a rush, and so we forget this part. So then the next step is to do our own work, is to take care of ourselves, because this is a lot of work. You already have job in teaching content, supporting kids, and, this is a part of it, is, making sure our classroom is trauma informed so that our kiddos can be there and listen. Use the resources in your school, such as your school counselors. I spend a lot of time in my classroom as a counselor educator talking to them about how to support their students and how to work with their teachers in supporting their students. So use the resources you have in your school, but also, do your own exploration of maybe any implicit biases that you have, because that can impact our reaction to kiddos. I've talked about how we need to kind of come in calm and, create that warm environment and be able to communicate with the kiddos. But if we're having biases to stories that they're sharing, or, things that have happened to them, sometimes that can get in the way. So do a little bit of our own work. And there's lots of books out there, videos out there that talk about that. And, I teach a course on that. So, it's really fun. We have a really great time in the 15-week semester doing our own work. It's hard, but it's rewarding. And also doing self-care. And I want to acknowledge that it goes beyond just doing yoga or going for a walk, which are really important. Like I start my day with yoga as much as I can. And I find that it can be really helpful. But self-care goes beyond to also making sure that you have separation between work and home, and you have time to take care of yourself, time with your family and friends, so that you can recharge and be your best self for both your family, but also your students in school.
You have time for a quick question?
Absolutely.
Yeah, so boy, trust is such a big part of teaching in general and reaching students. And one of our attendees asked a question. They have a young 5-year-old that has a really big trauma in that family. Obviously, there's not been a lot of time to create that level of trust, but do you have any tips for getting that young person to be yearning for positive attention rather than negative attention?
Yeah, and that's a big part that we're seeing in schools now, right? And so I'm not sure I have the magic answer you're hoping for, but really the big thing is, building that relationship and empathy. So taking the time to, have casual conversations with that kiddo, have them, stay in during lunch, maybe when when they're supposed to be having a consequence, but really spend that time getting to know them and building that relationship, personalizing things to them to get that buy-in. So finding out what they enjoy and being able to personalize whatever the activity is, to get their interest and spike their interests. But really, when they feel supported and care about, they're more likely to have buy-in with us and want to do good work because they care about us and they care about doing good for us. With 5, it takes time because they're just starting school, right? Like my guess is they're kindergarten or first grade, maybe. And so they are getting used to a lot, they're getting used to the school environment. But I would definitely recommend, getting some of those tier 2 supports as well as tier 3 of, making sure they have, they're doing groups with the school counselor, school social worker, whoever's doing that on that emotional regulation. And that as a teacher, you're really reinforcing and using that same language so that they're hearing it over and over again, but also just taking the time to really build that relationship. And maybe, that's a part of the lesson, with all the students so that they can feel that buy-in with their peers. So they know that they're part of a group and it's a team effort, but also with you and that you're in there with them and doing that work. And what is hard with this, and I got frustrated as a school counselor, is like, it takes longer than we think. So, we can do this every day for a year and we might not see any results, but we're going to slowly see results and it's going to happen. For a lot of kids, it happens a lot faster. So everyone's on their own time frame. So I would recommend being patient and keep trying with all teachers in the school.
And with 5 minutes left, I think I want to allow you to kind of cruise to the ending. And we do have one final question that hopefully we'll throw into bonus time there.
Okay. So the last thing I was going to say is that, we have courses that you can take here at PSU that kind of are aligned with some of the things that I've talked about. And we really talk about more in detail of these concepts. So if any of these concepts have spiked your interest and you're like, I want to learn more, you don't have to fully enroll into a program to take a course. So, but something I teach and we're teaching it this spring is advanced human development. So we talk about typical development of a child throughout all the ages. So starting with before you're born all the way to when we die. And I integrate a lot of how trauma can impact that development. So we talk a lot about the signs that we see and how to work through those in those course. And it's a lot of fun to kind of bring in examples. So I always love it when educators join that course. So, we can get the live examples. Another one is social behavior and diversity. And in that course, we really explore that implicit bias that I talked about. So we talk about different cultures in our society that we work with, and exploring the stories that we've learned as kiddos learning up all the way into whatever age we are now, and how that impacts our perception of others. So exploring that implicit bias, exploring how we are socialized beings. And then the other one, I'm always throwing a shout out for for the program that I'm part of. So if you are an educator at whatever level it is, and you're like, I like doing this trauma-informed work and supporting people with their trauma, and I want to learn more about it and how to support the kiddos that I'm working with, consider enrolling into the master's in school counseling. We have a shortage here in New Hampshire. There's lots of jobs, lots of needs, and it's a really fun profession. Hard, but fun for profession. So, and this is my contact information. I one of those people that loves talking about trauma and the impact. So if you have any questions, or we don't get to your question, please feel free to email me or call me, and I'm happy to talk about it. And personalize this to your classroom, because we all have different classroom settings, different structures, different layers of support. So it's really hard to create a presentation like this because everywhere is so different, but reach out and I'm happy to personalize it to you, and we can work through it together.
Are we ready for bonus time?
We are. Yes.
Wow. I'd like to thank everyone for attending. We do have 3 questions if we can get through it. So I understand this is a bonus time for everyone. But Rachel, first question, it's really a good one, but it's difficult. When there are student safety issues and the classroom needs to be basically evacuated due to a student that needs to be removed from that classroom due to just physical harm and just the safety of the students, what are your tips to help that teacher start over again, build that connection, and how do you move on after that?
That's a really good question. And I've definitely been in those situations where we've had to, have a teacher take their class out of the room. So then, me as the school counselor, a lot of times with the school nurse or whatever the situation is, we could go in and handle that situation. And you're right. What a transition back. My tips for you would be to acknowledge it. So maybe start with that check-in, of acknowledging that we did have a huge disruption. We're not talking about the kid maybe in this, but we are talking about that there was a disruption, and maybe it brought up things for others of us in the room, because remember, we don't know everyone who's experienced trauma. And, what can we do to kind of self-regulate again? So having a conversation about it. I also might put on like a body scan or a mindful moment to help regulate our emotions and model that. So we can maybe disclose like, yeah, sometimes I get stressed out too when, things escalate, but this is how we can support our peer in acknowledging and supporting them. And that's why we left the room, but now we're back, and what can we do to help focus back? So talking about the situation, modeling how to self-regulate, and then modeling that now we've had this time to do self-care. Now let's get back to work.
Yeah, and some more questions here. And basically all of these are just super tough, and just to commend all the educators who are here and the work that they do. But the first question is, how do you support a student using the 3 R's when their home interferes during the process, essentially sabotaging all of your efforts? The high school student is always in phone contact with the parent, et cetera, et cetera. Yeah.
Yeah. Yeah, it's really hard when we're doing our best work and then they're only with us for 7 hours a day, right? And then they go back home. And, so acknowledging within ourselves, so it goes back into that self-care of, we can only do what we can do. And sometimes what I would do is if I was noticing that a parent was maybe sabotaging something by, yes, those high school kids, they have their cell phones, they're getting that constant messaging that maybe isn't helpful, is I would coach the kid, and say, not put down the parent, because we don't want to like pinpoint and put people against each other, but just say, tell me what happens when you open up that phone and you get that text. You're like, what happens for you? And they're probably gonna say, well, I get distracted, but I have to do it. And it's like, yeah, you get distracted. Yeah. And so, I'm wondering if we can put that cell phone down while we're in class, and then you just check it between classes. And so modeling again that self-regulation, because as we know with kids, even without trauma, they're having a hard time regulating phone usage. So if we can help them with that, and I know a lot of teachers, they would have like a phone spa, like those shoe things where you can hang it on your wall and put your cell phone. That was really helpful. Don't let them take it with them when they go to the bathroom. So having that rule for all students, because remember, we want to be consistent. So for all students, they can't take it with them to the bathroom, or whatever it is, because yes, they're going to go home, they're going to go back and text. So really modeling, regulating, but ultimately we can only do what we can do.
And finally, the final question again, it's, how do you perform a paradigm shift within a school in regard to trauma in the classroom and how to deal with it? That is essentially the question. Just adding the final point that sometimes buy-in from adults is often just as tough as buy-in with kids. So I'm not sure what answer there is there, but there you go.
I don't have the $1,000,000 question or answer, but I will say, like, I know what the work that we were doing was, we started with, an all school kind of training on trauma and, something like this, and then really working with teachers of what can they implement in their school. Because you're right, it, like, in some ways we can do so much in our classroom, but then we also want it in this whole environment. So making sure we get the administration on board so that they're implementing practices like PBIS and restorative practices, and really making it an expectation for teachers to do this trauma-informed practice. And you're right, there's going to be some teachers that don't want to do this. But then it comes down to, we can control only what we can control, and doing the best that we can. And then that's how we are going to be that safe haven for students, is because we're going to be that safe class for them. But, and that also reinforces why those check-ins, and that, mindful moment at the beginning might be really helpful, because maybe they were with a teacher that triggered them before. And so now that they're with us, we want to regulate so then they can focus.
Rachel, sorry, I can't thank you enough. And thank you very much to our participants today for joining us. We really appreciate